Hey everyone, welcome to another week of Political Capital. I'm your host Rob Shaw, coming to you from the Check News studios in Victoria with all the latest on BC politics and another busy week. So I'm going to bring the panel in, not waste any time talking to you about the various formats and the YouTubes and the Googles and wherever you can get us. At this point, you know we're on Sundays at Check at 6:30. We're on audio, we're on video. You'll figure it out. You're already here. You're watching us. I don't need to tell you that. So let's bring in the panel and we'll get right to the topics here. As usual, Jillian Oliver, strategist extraordinaire from the BC Greens. Hello, Jillian.
Hello, thanks for having me.
You know, I don't write down strategist extraordinaire, but just every week extraordinaire leaves my mouth
Just
with you.
sounds right.
It just sounds right. Sounds so good. Maclean Kay, editor of The Orca. I've never used the word extraordinaire with you before, but thank you for being here.
Not one single time, but you're welcome nonetheless.
One day when you least expect it.
Working towards it.
Yeah. Katie is away this week, so we have a special guest joining us, Danielle Dalzell, who's a senior consultant at Earnscliffe, has worked for the NDP as a staffer in Victoria and Ottawa, most recently as a strategic communications director and a speechwriter for Premier John Horgan. Hello, Danielle. Thanks for being here.
Thanks for having me.
It's great to have you on the show, and we're going to jump into our first topic, which is ambulance reforms. And this has come up in the past since the heat wave. We've been talking a bit, mainly in Metro Vancouver, about challenges with ambulance response times, 4 to 16 hours in some cases and some stories. Kind of an uprising by paramedics and by some in the community to do something about this. Adrian Dix comes out this week. He announces 85 new paramedics, 22 new ambulances, a bunch of new stations and conversions over. More money, although not exactly sure how much, to try and fix this ambulance system. So I don't know if this fixes it, and I don't think any of us, have that expertise. But politically, let's go around the table, starting with you, Jillian. Does this do enough to end the criticism we've been talking about? Is it the kind of response that a government should be looking for in a file of this size? What do you make of it?
I think this is one aspect of the response. It's an important one, but what we're really talking about here is increased extreme weather events due to climate change. And there's a lot more types other than heat waves. There's also flooding, obviously wildfires, drought. And so the government is consulting on a climate preparedness strategy for the effects of climate change that are already underway. But it needs to back that up with funding. Local governments have been asking for funding. They're the ones that have to deal with the effects, and the effects of climate change are different throughout the province. We see in other jurisdictions that are more prepared, like New York and Paris, they have really robust heat wave response strategies, and those are implemented by cities, not provinces. The province's role is really to help cities by backing them up with funding so that they can deploy those resources quickly. The government cut the relatively small existing CAREP funding in the most recent budget. And local governments have kind of been sitting on their hands, waiting for what's going to come out of this strategy as it moves to the implementation phase. So lots more to do, and we'll see when that strategy wraps up its consultation this year.
Maclean, I don't think I heard climate change from Adrian Dix when he was announcing these changes, but Jillian's point is well taken, that it's much larger. The ambulance service is just kind of the tip of that iceberg in terms of people responding at 911 when there's an emergency. But how do you kind of put all of this together, and do you think it's going to solve the political questions the government's been facing?
I mean, we'll see is the short answer. I think Minister Dix would agree that the proof will be in the pudding. We'll see. To Jillian's point, yes, the heat wave was kind of a perfect storm, but there had been stories of people waiting hours and hours and hours for ambulances all throughout the year, especially outside Metro Vancouver, but not just outside Metro Vancouver. So we'll see. This does appear like a positive step. It does appear like these are good changes. But I mean, if those problems persist, then obviously there'll be calls to do more. This politically, yes, I think this will blunt some criticism. But again, if it doesn't solve the problems, then there'll be calls to do something else.
Yeah, it'll be a little difficult because hiring people takes time. All of this takes time, and yet 911 calls continue at a record level. Danielle, what did you make of the minister's announcement?
I thought it was significant. It was a great, step forward. I think we're dealing with unprecedented times. That was the word for 2020. It continues to be for 2021, and the heat dome was just that. And we're not equipped. We don't have air conditioning. We're just sort of, we're here on the coast, particularly, we don't know how to handle that. We don't have the homes that are prepared to handle that. And that was, and we saw, tragic loss of life as a result. I'm happy Minister Dix is on the case. He has done some really transformative things in healthcare. If you look at MRIs and the surgical strategy, he completely transformed that. He seems determined to fix this. As you say, it takes time to train people. It takes time to hire people. Nothing is simple, but I have a faith that he's going to do what it takes, but it will take time.
Yeah, for sure. I mean, Adrian Dix is, as a very accomplished health minister, we've talked in the past in the show about how brilliant he is. My take on this, I think it's interesting that he chose to make these reforms himself without, typically governments sometimes hire someone to come in and check out a situation, produce a report. I guess maybe they thought that would take too long. I don't know. But whatever it is, this is coming from the minister. These are his reforms. If they don't work, it's on Adrian Dix. There's no one else here at this point. We're not going to go back and blame the senior leadership of the ambulance service. He's endorsed them. No one got fired as a result of this. In fact, there was a memo that the Vancouver Sun reported today that they don't really even acknowledge any failures actually occurred as part of the response. So, okay, that's fine. But Adrian Dix has taken this on. He's analyzed it. He's put it together, and he has to wear the fact that the ambulance service response is going to get better or worse. And I think it's kind of an interesting position for him to take. But of all the ministers to kind of put himself in the firing line like that, that is Adrian Dix. So good discussion on that. Let's move on to the issue of safe supply. And again, another kind of announcement about a persistent issue, the overdose crisis. We have talked in the past about how nothing government seems to have done. The previous government and this government has really curbed the just incredible amount of deaths that are occurring due to the tainted drug supply. But the safe supply announcement is essentially that the provincial health authorities are going to have to come up with plans within a month or so to administer safe, clean supplies of mainly prescription opioids, fentanyl patches, medical grade heroin to prevent people from dying. It's not even about putting people in treatment at this point. They made that clear. The treatment is optional. It's about preventing deaths. And that sounds like a very leading edge, kind of interesting development by the province. Danielle, why don't we start with you on that? Is this where we should be going? Do we think it's going to make a difference? What do we make of this announcement?
I am really encouraged to see it. Toxic drug supply has taken so many lives. So many people have lost loved ones. It's obviously incredibly serious, and it's not an easy problem to solve. It requires treatment. It requires access to mental health services, to supportive housing. All of naloxone kits, all of those pieces come together to try to create a situation where people have access to safe supply. So I was happy to see it. It's an important step forward. BC is the first one in North America to take this approach. But we also need decriminalization of possession, which the minister has requested from Health Canada in April. So hopefully that will come through as well, which will be another step forward. But there is no silver bullet here. It is complex, and you can be making progress, and then toxic supply gets dropped in to the drug market, and you have another crisis on your hands. So it's difficult, but having an addiction is a health issue. It's not a crime, and I hope we can see movement from the federal government on that as well.
It would be nice to see movement from Ottawa, both on that, and it was mentioned in the briefing on this that the reason they have to use prescriptions to hand out this clean drug supply is because of the Federal Controlled Substances Act. So that's also a barrier to what they're trying to do here, and it leads to people in crisis or in need or having to access a prescription to get the medicine that they require. So it'd be nice to see more movement from Ottawa. I agree. Jillian, what do you think?
Yeah, I agree with Danielle. Advocates say that the prescriber model does still present a lot of barriers. You need to have a substance abuse diagnosis from a doctor. There's a lack of prescribers outside of the Lower Mainland, a lack of family doctors in general. It is still going to be quite difficult for people to access. And hopefully that exemption to the Federal Drug and Substances Act does come down the pipeline, because that will allow for easier access models like co-op and compassion club models that will be able to hopefully save more lives.
Yeah. Maclean?
Mhm.
There will be a lot of people that struggle with this, in that, just the government distributing drugs. And I would probably count myself among those. But I mean, the numbers are staggering and have been for a long time, in terms of overdose deaths. And so, they had to try something. I'm glad they're trying this. And I'm sort of hoping for patience all around, and patience with a C, to see if it can work. And, hopefully it does. But I also think that we should be patient with a T with people for whom this will be hard to swallow, for who need to take some time to process the government distributing hard drugs without a precondition for seeking treatment. So I hope this works. This is not a subject I have a lot of any expertise on, but patience, again with a C, is, I think, the best remedy for everyone.
Yeah, it's interesting to talk to. I remember talking to Health Minister Terry Lake in the previous government when this was suggested, and he was pretty blunt about saying he wasn't sure society as a whole was there yet to the idea that government is distributing drugs, a type of drug that's illegal to possess, although hopefully that changes, to people as medicine. But Dr. Bonnie Henry has been the one who's been talking about this, at least for the last couple of years, making recommendations that, unfortunately, even the previous government and this government kind of didn't act very quickly on. And I found it interesting to hear her. She got asked that question in the press conference. So would this have made a difference a couple of years ago? And Dr. Henry is very diplomatic, and she kind of said, "Well, I wish they had done it." And so maybe we'll just go around again. If Dr. Henry is the one pushing this, if it's not a political issue, if it's just experts pushing it, do you think we overcome that maybe societal hesitation to the idea of government handing out, medicine like this, Danielle? Does it make a difference having Dr. Henry behind it? And are we going to start listening to her again now, given COVID, when she became such a celebrity?
I hope so. And she has become such a prominent voice. People know her very well. The government has done a good job of not politicizing, allowing to listen to her as a scientific expert, lifting her up in that way and having her really fulfill that role through the pandemic. So hopefully this will help people listen to her and understand that it's really, it's not about stigmatizing people it's about a scientific solution. It's about a medical solution to a health problem. And if she can transmit that message through in a non-politicized way, which she has been able to do so well, I think that will help
Yeah,
in terms of acceptance.
for sure. I still wonder if it's a political issue. Overdoses have become, unfortunately, kind of almost political in a way. I hope that we don't get there, but it's a subject that's come up in the legislature, and I'm not sure it does us any favors to politicize it in question period. But no, that's good. I appreciate it. Let us move on to another topic here on cruise ships. And again, this has been an issue that Premier John Horgan has had to face the last few months, the idea that his government has somehow bungled the response to the Alaska cruise ship bypassing the Canadian ports legislation. Announcement from Ottawa this week that as of November 1st, cruise ships are now allowed in Canadian waters again. That's a bump up from 2022, so it looks like good news. I think the question, again, to go around the table is, does this take the heat off the Horgan government? Does it wash away that kind of criticism that it and the federal government didn't do enough to protect our cruise ship and our tourism sector? And if so, is the issue gone now? What do you think, Maclean?
It's not gone. The issue is now resides in the hands of the U.S. Senate, unfortunately, because from their point of view, it's a U.S. law that mandates U.S. ships stop in Canada for no reason other than playing nice. Again, from their point of view, to a lot of Canadian ears, this was difficult to understand and sort of counterintuitive. Well, of course, cruise ships stop in Victoria and Vancouver. Why wouldn't they want to? And to an extent, they're right, but that wasn't the reason they were doing it every single time. So if the U.S. Senate passes a law which is, explicitly advocating an America First policy, which usually sells well there's every reason to expect that at the very least, some cruise ships that would have stopped in Victoria, Vancouver, and elsewhere won't. And because the provincial government misplayed this and in fact was portrayed in the U.S. as, ignoring and then provoking the issue, yeah, unfortunately, there's a chance that not to not to use a pun, but the ship has sailed, and so we'll see what happens in the States.
No nautical metaphors. That's the rule. Can't the ship sailed and the choppy
I
waters and the iceberg and all that. No.
You will call me extraordinary once before the end of this.
Okay, fine. That's fine. But yeah, Rob Fleming was asked the question at the press conference, what does this do to the whole U.S. legislation? And I think he very smartly said, I don't want to speculate on that issue, given that the government has speculated on it in the past and got it completely wrong. But he said it washes away the pressure and maybe the animosity that existed towards BC from Alaska and other places. Maybe this neuters the bill that was on the floor of the Senate to make this permanent. I don't know, Danielle. How do you put it all in perspective?
I mean, it's a tough issue. Tourism operators are struggling. I don't, this was spurred on by the pandemic. It's now we're seeing light at the end of the tunnel. I think the announcement was good. It was a good step by the federal government to provide clarity on a date, and then they can work towards that. Hopefully there can be some intergovernmental relations work behind the scenes to make sure that those senators don't pass those bills. But as Rob Fleming said, it's tough. You don't have control of domestic politics in the U.S. and it's a difficult issue. I hope for the best on that. And we saw from the Prime Minister some clarity on what maybe that could look like in terms of, will these people be fully vaccinated? They will probably be required to do that as of September, or tested, or proof of immunity. So we'll have some, regulations around that to work with. But November is kind of interesting because it's actually going to be probably more like April of 2022.
Yeah, it's the end of the cruise season.
So it's
yeah.
It's November 1st is the season is over by then.
Yeah.
So we really won't see this play out and become a real thing until spring of next year.
You're right. It's more of an optics thing. And the cruise sector did ask for that date of November because they wanted that public declaration out there to give confidence to the cruise sector to book their trips for next year. So that it's all kind of optics in some way. Jillian, what do you think?
Yeah, I agree with Danielle again. I think that this was, another signal that the Liberals are looking at BC and that for a possible snap, or very likely, probably inevitable snap election that's happening now, and that they wanted to get ahead of this before they actually officially start campaigning. Because it doesn't make a difference. They moved the timeline up 4 months, but it's not going to make a material difference in terms of when we actually see cruise ships docking in our cities. And I think I think that in terms of the political ramifications for the New Democrats, this does help a little bit, just in reminding people that the feds bear a lot of responsibility for this as well, that this isn't just, or it isn't at all really provincial jurisdiction. Of course, they could have done more, but ultimately, who comes through the borders is the federal government's decision.
Yeah. No, I mean, that was always the weird thing about it, is that it wasn't BC's call, and yet John Horgan became this kind of cartoon villain that Alaska used as a punching bag for its own domestic points, political points. So, and he didn't have any power to do anything about it. I mean, he could have lobbied stronger. But my take on the cruise ships is I think, the U.S. vaccination rate is going to play a big role here. We don't know what the health restrictions are. We know the U.S. is not well positioned for the Delta variant, stalled out on vaccinations. Los Angeles made masks mandatory again the other day. Hospitalizations are on the rise. If they are not in a great position, it's going to be hard to imagine opening up our ports to them unless everyone is guaranteed vaccinated, and that's agreed to with the industry. And even then, might raise some eyebrows, depending on what things look like beyond November. But who knows? We can't predict that far ahead, anyways. Our hot take this week, to move on to that, is the federal Greens, the Gong Show, just the Gong Show that is the federal Greens. And before we even do that, I almost think the federal Greens at this point deserve to lose, based on the horrendous way that the party has imploded and picked on their leader. The latest reports that from the CBC and elsewhere that the federal Green Party executive is considering revoking the party membership of leader Annamie Paul, I guess as a roundabout way of rendering her ineligible to be leader without having the courage to come out and vote her down, even though there's still a vote coming. We've heard, the freezing of her election budget and her riding, all sorts of continued infighting on this. So I think the hot take question for everyone to go around is, assuming we have this snap election in August or September, do you think that Anna May Paul is still the leader of the federal Green Party in that election? Jillian?
I'm going to say yes, because I really hope that she is. I think, the way that the federal Green Party's council and interim executive director are treating her is abhorrent and detrimental to the party. So I really hope so.
Yeah. Danielle?
Mm-hmm.
Yeah, I agree. When I saw the membership review on Twitter, I thought, oh, they're going to trigger a leadership review because it was a membership review of the leader. And then I read the article and I said, they're actually like investigating whether she can be a member in standing of the Green Party, which it is, as you say, it's trying to use tools behind the scenes to see what you can do to further undermine her. Every single article comes with 2 or 4 anonymous sources from inside the party. It seems toxic and awful. And, I at first I thought, oh, she's made, not the greatest calls. She had a not great staffer. But now the tables have turned and it's just, it seems completely unfair to me. And I hope she can retain leadership. But it is a really, it's shocking to see. I don't think we've quite seen anything like this in politics, like in Canadian politics before.
No, because it's such a bad thing for a party to do on the eve of an election. It just shoots themselves in both feet. It's incredible to watch. Maclean, what do you think she'll be the leader if we have a snap election?
I think so, if only because of the time left. There's not a lot. It seems as though they've taken their best shot and apparently missed. And she's not gonna. I mean, if it's a game of chicken, she's not gonna step down. If anything, she'll go into the party leading it out of spite.
Right.
But I mean, it would be amazing if she is the only one with a seat left after the election in the fall, which is not impossible at all.
Well, I wonder what this does to the 2 remaining Green MPs who've been kind of silent on this. They're going to need to take a position at some point, and we haven't seen that from them either. So I think she will, but man, the damage has been done here, and the Greens may get wiped off the map or rendered even more irrelevant. So we will see. Thanks so much. Thanks everyone for being here on the panel, and thanks everyone for watching. We'll see you next week on Political Capital.